Depression is a medical illness, and it is something that has to be taken very seriously. When it's not treated, it can go on and cause tremendous disability and impairment for the person, not just for them, but for their family, for their job, and otherwise. So it has to be taken seriously, and I think educationally speaking, we have to understand that one cannot fix their own depression, that something is taken hold in the brain, in the neurotransmitters of the brain, that make it hard for the person to just buck up or to, give up all the responsibilities and then they'll get better. It really is something that happens that has to be treated. Often, there's nothing anyone who has depression can do to make it better themselves. It is not because of their weakness of character or some other flaw that they aren't getting better. They need an intervention, a medical or psychological intervention that is going to help them treat this depression. Some of the treatments for depression are medications. There are a variety of antidepressants that work very well in the treatment of depression. One can also employ psychotherapy. This is a talking therapy, and that alone may be enough to treat a depression, but sometimes it's the combination, and often it's the best treatment to use both a medication and a therapy. There are many different kinds of therapy, from insight-oriented therapies to cognitive behavioral therapies, and they run the gamut. And you can find providers who do different kinds of treatment, whether it's medications or different kinds of therapies. And also there are social treatments for depression. If somebody is having trouble with housing or is having trouble financially or with a job, there are different kinds of counselors or social work professionals who can help with these issues so that you're actually attacking depression from all sides.